Good afternoon, everyone. Uh, Welcome to our live session. This is Fahad Shahid here with you from the platform of Prime Digital. We invite you all for this wonderful, important session that we have today in regards to World Cancer Day that we have talking about the topic for today, that is understanding cancer, the disease with stigma. It's really very important for all of us to understand the awareness that we all have to, and in fact I should say need to, spread out to everyone, because this is a responsibility of every one of us. Let me just introduce you uh, to this particular World Cancer Day, or this is organized by Union for International Cancer Control, Cancer Control, that is UICC, and celebrated each year on 4th of February. That's an opportunity to rally the international community to end the injustice of preventable suffering from cancer. World Cancer Day aims to save millions of preventable deaths each year by raising awareness and education about cancer and pressing governments and individuals across the world to take action against the disease. I have with me the guest of the day, Dr. Arun. Doctor, thank you very much for joining us today. Just wanted to tell Dr. Arun has an extensive experience of 10 years, and for the last 3 years, he's been practicing in UAE with Prime Healthcare Group. Dr. Arun's expertise are management of cancer, including chemotherapy, targeted therapy, immunotherapy. You talk about special areas of interest in management of cancer patients and other palliative care. Specialized procedures such as bone marrow biopsy test, and intraperitoneal chemotherapy, and of course cancer screening. So we've got plenty of experience that we have on screen today. Dr. Arun, once again, thank you very much for joining us. And doctor, talking about a very important and a special, I should say important disease, I should say, rather than special. We all need to understand how deadly cancer is, and cancer has many types of uh, types, I should say, and it's really important to understand about it. So, doctor, what do you have to say on this part? It's a disease with stigma. I will definitely not take further time, and I'll give it to you. Please proceed. Thank you.
Thank you, Mr. Farah, for a lovely introduction. And you rightly said that this World Cancer Day is celebrated on each year on 4th of February. The main goal of this celebration is to improve the awareness about the disease in our population, so that we can improve the chances of early diagnosis and curing this disease. Uh, our goal or the theme of this topic is to see whether still the cancer word is scary, or see what is scary, or whether there is some still stigma to this diagnosis. Before 30 to 40 years of period, cancer disease was definitely very scary disease. There were very few centers of diagnosis, treatment available to the population. Nobody was knowing about what is cancer. Very limited information was available from the research. There was less chance that a patient will get diagnosed in early stage and will be cured. However, the things have significantly changed in the last 20 years, I will say. For example, I will give one important information that in the last 2 3 days we are getting requests from different newspapers to give some of the patient feedbacks or the story information about the journey to the cancer diagnosis and treatment. So when we approach our patient, I see a surprisingly very good response, and most of the patients were ready and happy to share their story. And good thing is that two patients came completely out with the newspaper, and they have given their full story of how they were diagnosed and how the treatment was going, what can be the what were the challenges faced by them, and they were given their name directly in the newspaper. So this is very good positive sign that the cancer is not now considered to be stigma, and people are coming out with their stories, with their diagnosis, and they are supporting different other population, family members, friends in handling this kind of diagnosis and its treatment. So this is the awareness, improvement in the awareness of the disease, which has led to significant change in the behavior how we treat this disease. So going to this disease, cancer is still considered to be fast growing disease, and we can see that the numbers are rising in the last uh, few decades. In each country, we see increasing number of diagnoses each year. This is common in both of the developing or the developed nations. With each year, we also expect lots of death because of cancer. As per the current figures, it is around 10 million deaths which happen because of the cancer each year. On the opposite side of the story, there are good signs or positive signs that there are lots of increased number of patients who are getting cured by the cancer because of the current treatment strategies. So there are very good improvement in the techniques for the treatment and diagnosis, and now there are lots of cancer survivors which are living their healthy lifestyle. So as an example, I can say that in the last 20 years, we can see increase of almost 15% of survival chances in the cancer disease. The figures will be different for each cancer, but on an average, it is 15 to 20% of improvement in the cancer survival or the cure chances in the last few decades. That is very good improvement in the overall prognosis of this disease. So let's go into more detail of this disease. So what is cancer? Cancer is a disease in which the tumor cells start in our body. Tumor cells are basically cells which has converted from the normal cells, and they have grown into a modified cell which does not require any growth signal or restriction from the natural mechanism, and it start to grow out of control. So when these kind of cells start in some part of the body, they try to spread to other areas and become malignant. So cancer word is typically limited to these kind of cells, which are also called malignant tumors. The tumor word is slightly different, and it includes diseases which are either benign or malignant. Benign tumors are diseases which are generally limited to the site of origin. There are some examples like fibroadenomas of the breast, fibroadenomas of the uterus, sometimes swellings coming up in the skin like lipomas, fibromas. So these are the cells which does not have tendency to grow out of the area of origin. And generally, most of the tumors or benign tumors do not require any kind of treatment, except when they are very big. And they can be easily taken care with the help of a simple surgery. On the opposite side, there are some tumors which are called malignant tumors because they have very high tendency to grow in the nearby areas or spread to the different other distant part of the bodies. These are called typically cancers. Uh, so malignant tumors again can be divided into different categories. Broadly, we can say malignant tumors are either can be solid tumors or they can be related to the blood cells or hematological cancers. And solid tumors are like, for example, breast cancer, cancers of the intestine, prostate cancer, lung cancer, bone tumors. And hematological tumors are generally like lymphomas or blood cancers, CML, acute leukemias, myeloma. So broadly, we can categorize the cancer in two separate groups. There are certain cancers which are more commonly seen in the population. For example, if we see the adult population, in males, we generally see commonly lung cancer, prostate cancer, colon cancers, and head and neck cancers. In females, we generally see commonly breast cancer, cervical cancers, colon tumors, thyroid tumors, and ovarian tumors. There are certain tumors which are very unique to the young age of population or the pediatric group of population. For example, there are tumors like bone tumors or osteosarcomas, sarcomas, some of the blood cancers, some of the cancers like Hodgkin's lymphoma, certain tumors of the eye like retinoblastoma or liver like hepatoblastoma. They are very commonly seen in the young age of population. They generally restrict into in the childhood population only. The incidence is not so much as compared to the adult tumors, but still there are significant number of kids affected by this kind of tumor. They are very unique as compared to adult tumors because they have different prognosis, different survival chances, and the treatment is also taken care in different manner. But just to highlight that no age is exempted from the diagnosis of cancer. Even we have seen patient which in the few months of life has developed some kind of cancer. So anybody at any time can have this kind of disease. So there's no criteria that we can limit for the diagnosis. Going into more detail, what can be the risk factors or causes of cancer? Uh, Frankly speaking, in each patient of cancer, it is very difficult to say what is the cause for his disease. However, there are some proven risk factors which are studied in last many years of research, and they have been clearly documented that they can increase the risk of developing this disease in one of the person's life. So there are certain risk factors which are called modifiable risk factor because we can change them or we can try to reduce them and reduce the risk of cancer related to them. These include some of the habits like smoking, alcohol intake, our rapidly changing food habits like more dependent on the processed food or snacks or the fast foods, less physical activity, increasing incidence of obesity, sedentary lifestyle. These are generally considered to be modifiable risk factors. There are certain other risk factors like our genetic structure or some of the hereditary mutations in the genes which are passing on the families, certain exposure to the environmental radiations which we cannot do anything. So only for the modifiable risk factor we have opportunity to control them or limit them to reduce the risk of cancer in our lifetime. Presence of a risk factor does not mean that you will develop a cancer because it is just a risk factor. It increases the possibility or the chance of getting a disease. This is very common question I heard from lots of people that I am smoking, but what is the chance of developing? So it is very difficult to give the exact figure, but more you are getting exposed to the risk factor, more will be the chance of getting the disease. If you limit the exposure, the risk will decrease significantly. The person who does not have this risk factor can still develop the cancer disease, which is still in the research why it is happening. There are lots of research going on that kind of situation, that why certain people without any major risk factors develop the cancer disease. So basically the cancer is related to our balance between the immunity cells and the cells which are getting damaged on day-to-day basis. We have good immunity in our body which try to control these bad cells, and they generally try to remove it on the daily basis. However, when there is some dysfunction related to this immune control, patient can start having that cancer disease. So currently it is believed that if we control the modifiable risk factor, we can prevent 30 to 50% of the cancer diagnosis in the world. So by limiting or avoiding smoking, alcohol, going back to the good physical activity, that is at least 20 to 30 minutes of regular moderate exercise or walking per day, or going back to the good balanced diet which includes all different type of variety of vegetarian foods or the properly cooked non-vegetarian food, dairy products, dry fruits, this will reduce the risk of getting cancer significantly. But it has to be maintained over time. This is not related to a single exposure or few months of change. The change has to be on very long term basis. Now going back to the symptoms or the signs, how the cancer present. There's no single symptom or sign or presenting feature which can confirm the diagnosis of cancer. However, there are certain important red flag signs or symptoms which we have to take more seriously. Presence of any lump in the body or any new swelling, presence of bleeding from any area which is not because of any clear reason, unintentional weight loss in the last few weeks or months, sudden change in the habits of stool or urine, persistent back pain, persistent coughing, persistent headache without any clear reasons. These can be the underlying signs of any early stage of disease. It is important to remember that these symptoms are not only present in cancer, but they can represent a disease called cancer. And it is important that if we have this kind of symptom which are not going away or improving in a matter of couple of weeks, we should take help of a physician to evaluate it more. So once you have this kind of symptoms, you have to go to the nearest doctor or the family physician, and they are the right person who can tell you like what test has to be done later on to confirm that whether they are related to some serious illness or not. For example, there are certain symptoms like presence of breast lump or discharge from the vagina or bleeding symptom or weight loss, which can clearly or which in many cases are representing the cancer symptoms. Many females are not going for the medical advice when they feel some breast lump or they have certain discharge from the vagina or abdominal bleeding tendency, and they miss the diagnosis, they delayed the diagnosis, and ultimately they are detected in very late stage of disease, which make the treatment very complicated and difficult to cure the disease. So it is important to seek medical help as soon as possible. Your physician will be the right person to say whether these symptoms are related to the serious illness or not. Whether we can detect this cancer in very early stages. Yes, so it can be done with the help of screening techniques. There are now clearly proven research that there are certain tests which we can use to diagnose the tumor in very early stages or even in the pre-malignant stages. So there are certain tests which are proven by the guidelines and can be used in certain group of population to diagnose the cancer in very early stages. For example, there are few tumors like breast cancer, cervical cancer, colon cancer, or the prostate cancer, where we have now very standard test available, which can be used in certain population group, and they help to diagnose the tumor in very early stages. For example, in the breast cancer, we have mammogram. As per the current recommendation, females of more than 45 to 50 years of age can start the mammogram on a yearly basis. We have seen lots of patients who are coming with a diagnosis from the screening mammogram. So lots of females are getting diagnosed based on the just screening mammogram. We find something very small in that area, suspected lesions, and when we test more, we confirm the diagnosis of cancer. So that gives the best possible chance to cure the cancer. Detecting a disease in early stages increases the chances of cure as much as possible. So it is very important to be aware of this kind of test availability. Not everybody will be a candidate for it. There are certain age group criteria which we have to follow, and not negative test also does not rule out that you have cancer. So it is on regular basis we have to do these kind of checkups and to improve the chances of detecting the cancer early. For the cervical cancer, we have very good test called pap smear, which can be done very easily in the gynecological OPD. It can detect the cervical cancers in the pre-malignant phases and gives the high chance of curing it even before it is developed. For this colon cancer, we have a stool test or the colonoscopy, which can be done on regular intervals. For the prostate cancer, we have a very good blood test called PSA. It is a tumor marker and can be started after 50 years of age on a regular basis for every few yearly. There is new recommendation for the lung cancer also. It is limited to the very heavy smokers, and simple CT scan can be used to detect any new lung cancer spots. So these type of screening tests are now tests are very easily available, and your primary physician or the family physician can guide you for more detail how to proceed for that. Then once it is suspected, how to diagnose the cancer disease. Once your physician is suspecting something serious, they will either refer you to the specialist or they will start evaluating it more. There are certain tests which are very important to diagnose or confirm the cancer diagnosis. There is no specific test or list of tests which we are following. However, the tests depend on the suspected disease or the type of cancer. However, the most important test I can mention is the biopsy, which is basically taking a small amount of tissue from the suspected swelling or the lump, doing some staging scans like CT scan, MRI, or the latest scan called PET-CT, doing some certain blood tests called tumor markers, and doing sometime very specialized kind of test called molecular mutations or the genetic structure analysis of the tumor cells. So there will be some battery of tests which will be done for each person, and that list can varies according to the suspected diagnosis and the patient to patient. So we have to follow these different tests to get enough information which will help us to confirm the diagnosis, confirm the stage of the disease, and to select the treatment option on a specific basis. Once the diagnosis is confirmed, then how to proceed for the treatment of this disease. In the last 20-30 years, we have seen a significant change in the treatment of disease cancer. There are lots of new therapies coming up very rapidly in the research and in the practice. Particularly in the last 20 years, we have seen lots of new changes. Uh, Primarily, there are three different modalities of treatment for the cancer disease. One is the surgical treatment, second is radiation therapy, and third is systemic therapy. Surgical treatment and radiation therapy both are considered to be a local treatment. That means they will try to clear the cells from certain specific area of the body. For example, if there's a breast lump or breast cancer, we'll try to remove that lump along with the breast tissue. If there's a colon or intestinal tumor, we'll try to resect that area. Prostate tumors, we'll remove the prostate area. So like that. So similarly, the radiation therapy also try to kill the cells in one particular area of the body. Opposite to that, there is a systemic therapy option, which are basically medicines, and they try to kill the cancer cells in each part of the body. So the all these three modalities are the main treatment options, and each patient, their cancer and their stage will require a different treatment approach. The treatment can be a combination of different modalities, or it can be a single modality. The sequence of treatment may also change depending on the stage of the disease or the type of cancer or the patient fitness or the general condition of the patient. There are very latest changes which happened in the last few years in these techniques. If we start with the surgery, there are new techniques for the surgical resection of the tumors, which are called minimally invasive surgical techniques. The latest one is the robotic surgery or a robotic technique to resect the tumors in certain complicated areas. These techniques are now commonly used in certain tumors, and they have helped to improve the chances or the precision for the surgeon to resect the tumor to a complete extent. Plus, they have advantages that the patient recovery from the surgery will be very fast and the expected complication rate will be less, because the surgeons are using direct vision with the help of a laparoscope or robotic arm to resect the tumor from the minor places also. These type of techniques are now commonly used in certain areas like for the prostate tumors, lung tumors, or gynecological tumors. In the radiation also, there are lots of development, and in last 20 years, I can say that the radiation treatment has changed completely. Now it is more on based on the computerized technique or focusing the radiation on a very limited area to avoid the side effects to the nearby organs. Most of the techniques are now image guided and try to reduce the risk of side effect to the nearby organs. They are very latest type of techniques like SBRT or the cryotherapy, which can also improve the chances of certain tumor areas. There new the latest form of radiation therapy called the proton therapy, which is now becoming easily available in certain countries and particularly used for certain tumors like prostate tumors to improve the chances of control as well as reduce the chances of side effects. Coming to the third modality, which is called systemic treatment. Again, in the last 3 decades, we have seen lots of development in this group of treatment. Uh, Before 30 years, maybe there were only a few limited drugs available for the treatment of cancer, which are called chemotherapy. However, with the lots of research which happened in the last few decades, now the list has increased to almost 400 type of different type of medicines. Few of the medicines are called typical chemotherapy or conventional chemotherapy because they kill the cancer cells by direct methods. But there are new forms of treatment which are called targeted therapy or immunotherapy, which works in slightly different manner, and they are also used in different kind of cancers. So basically, the targeted therapies are based on some of the molecular changes which happen in the tumor cells. Either they have certain targets or the driver mutations which help to grow the tumor cells. If we are able to find out certain medicine which block this driver mutation, then we can control the tumors. That is the basic principle of targeted therapy. So there are lots of new medicines which has been used, which have been commonly used now, and they are very standard of care and commonly used in certain group of tumors. For example, lung cancer, there are lots of new targeted medicines available. They are particularly used for the advanced stages of the disease. They require very important molecular analysis of the tumor, which can be done from the biopsy sample. And based on that, they are selected for the treatment options of the patient. These kind of targeted therapies are different from the conventional therapy because they have different type of side effect, and the common side effect like vomiting or the hair loss are not present in these kind of options. Most of them are available as a oral form. There are certain IV or the injectable options also, and they have made the treatment options very easy for certain group of patients. The latest form of systemic therapy, which is now available, is called immunotherapy. So basically, the immunotherapy type of drugs work by activating the person's own immunity or the immune cells to try to kill the cancer cells. There are lots of different medicines now available in this group also, and they are particularly used in cancer like lung cancer, head and neck cancer, melanomas, or the breast cancer. And they have improved the chances of controlling the cancer significantly as compared to previously available options. Most of these options are again used in the advanced stages of the disease, but with the growing research, hopefully they will be available for the early stage disease also. So basically, the treatment plan will depend on person to person and their type of cancer, their fitness, their stage of the disease, and the sequence of treatment may also change as per the these factors. Each person is different, and their treatment plan can be different as compared to other. We cannot compare two person having the same kind of tumor and their treatment options. One may require to be started with the surgery followed by chemotherapy or radiation therapy. Other may require first chemotherapy or systemic treatment followed by surgery. So treatment plan can change as per the patient. But it is important that to discuss this all information with your doctor as much as possible. It is important to discuss each and everything, whatever queries you have before starting the treatment. So you will become more aware of the possible or expected complications or the side effect, and will be more comfortable to complete the treatment in a right manner. So overall, I can feel that the cancer word is not scary now. It should be considered as important disease which require urgent diagnosis, earliest diagnosis and treatment. However, it should not be considered as a stigma. And overall, the cancer diagnosis has to be considered like it should not be a reason to fright, but it should be a reason to start fighting for this disease. Thank you. If you have any questions, I will be happy to answer them.
Thank you very much, Doctor. That was a wonderful explanation. You've started from the beginning, and you've completely, touched probably all the topics that are really required, to spread the awareness out there. Thank you so very much, Doctor. I've got a question here coming in that has come from Mr.
Okay.
Benazir, and he's
Okay.
saying that, "Good afternoon, Doctor. Please explain X-ray dose and their effects on genetics."
Sorry for the X-ray dose. They are asking.
Yes, Doctor. X-ray dose and their effects on genetics. That's the question appearing on your screen,
Okay.
Doctor.
Okay. Yes. So X-rays are also considered to be carcinogenic. Carcinogenic means they can increase the risk of getting cancers. However, the routine dose which is used in certain diagnostic techniques like the routine X-ray or the CT scan, they are not still very high and they will not increase the risk of getting cancer. But there are certain scenario like when we are getting very high doses of radiation, either from the environmental sources or like kind of situation like atomic bombing, or in certain scenario like when we have already treated a cancer in the past with the radiation therapy, that dose can definitely increase the risk of getting a new type of cancer, uh, uh, which can develop after many years of previous treatment also. So X-ray is definitely one of the carcinogenic risk factor for us. And basically the mechanism is that it will increase the chances of errors in the DNA, and it can cause some permanent DNA changes which stimulate the cells to grow into the cancerous cells.
Right. Thank you. Thank you, Doctor. I've got another question from Mr. Paul, and he says, "Doctor, is there a possibility of having recurrence when you are still undergoing
Okay. Yes,
in the
definitely.
course of
Yeah.
chemotherapy?"
Yes. Yes.
Doctor, are
So
you able to hear me?
yes, I can hear
All right.
now. So
Yeah.
each cancer is different, as I told in the previous my discussion, that each person tumor will be different. There are certain factors from which we can at least say that what is the chance of curing the cancer, but still there are many patients, despite having a treatment or while ongoing treatment, they can have recurrence of the disease. It is believed that this happens when the cancer cells become resistant to the ongoing treatment. So as the cancer cells are very autonomous and they change themselves very rapidly. So the goal of treatment is to remove these resistant cells also. However, that is not feasible in 100% of the cases. And depending on the diagnosis stage, there is a risk of recurrence for each person. So that can happen while ongoing treatment also. And it is particularly common to see progression or the recurrence of disease when we are dealing with the advanced stages of the cancer. Because in that we does not expect a complete cure. Most of the time the people or the person will get benefit for a certain time. After that, again the tumor cells will start going back. That happens because the cancer cells has become resistant to the previous chemotherapy or the treatment option.
Great. Thank you. Thank you so much, Doctor, for this explanation. I've got another question from Dr. Asia, and she's asking early signs of colorectal cancer. How to go ahead for screening, Doctor?
So colorectal cancers can be detected in early stages, and we need to just remember that the presenting symptoms can be just change in the stool habits, like in the last few weeks or a few months, if you are noticing any change, like previously the stool frequency was very normal, the stool consistency was very normal, but now it is becoming either constipation, or there's a frequency of stool called diarrhea, or there's any change in the stool consistency with the and it is present with some discomfort, or there is a repeated or intermittent bleeding in the stool. So these can be the early signs of any intestinal growth or cancer. If they are present, we have to go for more detailed testing, like we have to sometimes go for stool analysis, sometimes we have to go for endoscopies or the ultrasound or CT scan to confirm the diagnosis. There is a screening also, as I previously mentioned, that for the colon cancer now we have a standard test called stool analysis, which can be used on every 2 to 3 yearly basis. Generally, it is started after 50 years of age and can be repeated every 2 to 3 yearly to see if there is a minor bleeding in the stool. If that is present, we have to go for a further evaluation with the endoscopy to confirm whether the bleeding is because of the tumor or something else. So presence of bleeding in the stool does not mean it is a cancer, but we have to analyze more. Same thing, if we have a person or family which has already lots of family members affected by the colon cancer, or we are suspecting some hereditary risk factor for those members, then we can start this kind of screening in very early age group also, like starting from 20, 30 years. There are certain syndromes which are linked to the cancer, colon cancer risk. In those syndrome, we advise family members to start the screening in very early age, like around 20 to 30 years particularly.
Thank you so very much, doctor. Another question followed by the previous one, Dr. Asi has asked again. Any significant signs and symptoms for parents to know and seek guidance for their children? Early signs of cancer among children, actually.
Yes. So as I told previously, that the cancer which happen in the early age group are very unique. And as I told, that there are certain tumors like which can affect the eye or the bones or liver, kidney. So the common presenting symptoms will be like limited to these areas. For the retinoblastoma, which is a eye tumor, there is a very unique symptom or presenting feature which is called cat's eye sign. The parent can see that there is a white spot in the eye, in the black area of the eye, and if it is present in one side of the eye, then it may be a presenting sign of this kind of tumor. Then any change in the behavior of the kid, like if they are not eating well, they are not maintaining the growth pattern, or they are losing weight, if there is a fullness in the abdomen without any reason, or if any swelling or lump is visible on some part of the body, then it has to be analyzed more to confirm that whether it is related to the cancer or not.
All right, doctor. That was well explained, doctor. Doctor, moving towards the end of the session right now, you've probably explained a lot of, given us a lot of information. You've explained a lot regards to cancer, the disease, and specifically on this special day, 4th of February, which is dedicated to the as the World Cancer Day, the awareness. And I'm sure a lot of people would have, would take this message from you and would understand, as our topic itself says, understanding cancer, the disease with stigma. Thank you so very much, doctor, for the information. Doctor, what is the take-home message what you would like to give us here today?
Okay. So the most important message is that it is not a stigma now, and it can be conquered easily. The fight, the diagnosis of cancer should not be a fright; it should be a fight, and we can
Absolutely.
conquer this disease.
Absolutely, that's really great, doctor. Thank you so very much, doctor, for the information. Before we close up the session, I would like to let our viewers know that your recommendation is important for us. Please give us a feedback with your reviews on Google review and on Facebook page that we have is Prime Health. And you can give us reviews there. For all the updates regards to Prime Healthcare Group, you're always stay in contact with us through social media. You can stay in contact with us on Instagram, on LinkedIn, on Facebook, and even for your details that you would like to understand or know, if you have a record in Prime, if you're waiting for any test reports or test results, you can see the Prime Health Me app is there for Android and iOS. You can always download that. For booking an appointment with Dr. Arun, who's currently practicing in Prime Hospital, Dr. Arun, you can always book an appointment on the number that is given on the screen, 0429297777, and you'll be getting through to Dr. Arun as per his schedule. Thank you very much, everyone, for watching us at this time. We will be coming back to you another live session. Thank you very much. Take care. Bye bye. Thank you, Doctor.
Thank you.